So I just want to welcome everyone to the North YMCA. And from this space, we've launched our New American Welcoming and Community Engagement work. And I'm very proud to share that you're seeing the result of it right now. So the beautiful fabric we've woven of all the different colors, textures, heights, languages, flavors, smells, all coming together in this room is the community we call Northland. On Saturday, I had the pleasure of cleaning up trash on 161. And again, those who clean and serve this neighborhood reflect the full rainbow of colors, personalities, and so we are truly a community. And outside on the table, you'll see some paperwork that invites you to become deeper connected to this community we call Northland and the community we call Columbus. And one of the more fun ways that we've engaged people to appreciate the diversity is we have a food tour here in Northland. And it invites you to start your exploration into cultural, your cultural development is through food. And so we have several restaurants we want to welcome you to and engage you in. And today I want to most notably thank the Himalayan Grill, our Bhutanese Nepali brothers and sisters. Namaste. Thank you. And Hoyo's Kitchen, a Somali restaurant that is a neighborhood fave. The other thing I want to highlight is that the space we're sitting in, we had dinners every month this year, January, February, and March, where we got to talk to each other as neighbors and as a community. We had City Council President Harden here for one of those dinners. And what we got to see is just how connected we are, how much we have in common. But and for that, I want to make sure we recognize and thank the Department of Neighborhoods for bringing us together. They supported our partner Refuge, and so let's give Department of Neighborhoods a hand. And so each of these individual actions helps us to bring that fabric even more tightly woven and connected. And today, I think we're going to see and hear about the many great things we're doing to build community, but also where we have opportunities to go even deeper. So again, I welcome you to the Y. I thank you for coming. I hope that everybody here can make themselves at home. And I want to turn the mic and the presentation over to City Council. And again, thank you for bringing us together, Council President Shannon Harden. Thank you.
All right, now it's my turn. Good afternoon, everyone. On behalf of my colleagues at Columbus City Council, I just want to say thank you for spending your lunch break and your time here with us this afternoon. Certainly want to shout out Malik Moore. I had coffee with Mr. Steve Ives, who runs the YMCA here in the city of Columbus, in the region. And half of our coffee, we talked about Mr. Malik Moore. Because what he is doing to globalize a conversation about us and togetherness is truly, truly, truly special. And it really speaks to who we are as a city, who we are as a region, and what the YMCA is all about. So could you give it up for Mr. Malik Moore and the YMCA? How many people are here because of Malik Moore, actually? There you go. Columbus has a long, proud history of being welcoming and open community for immigrants and refugees. Mayor Ginther's New Americans Initiative, the many social service agencies focused on New Americans, and Councilmember Elizabeth Brown's work to keep families together are just a few of the many ways the Columbus community has come together to support our immigrant and refugee population. But last year, in direct conflict with this country's founding principles, the President of the United States singled out immigrants and refugees through his Muslim ban. This prompted a conversation in cities. How are we going to stand up for all of our residents, particularly those that are under attack? In Columbus, we responded. Mayor Ginther took action by signing the executive order stating that not only does Columbus welcome refugees and immigrants, but that no city resources would be used in pursuit of enforcing federal immigration policy. Furthermore, the executive order reaffirmed that the city will offer the same services to immigrants and refugees that are offered to all residents, and that we will vigorously oppose any effort to require the use of local taxpayer resources for the enforcement of these federal immigration rules. Council, with the leadership of Councilmember Elizabeth Brown, set aside dollars to provide legal assistance in an effort to keep families together. And finally, under former Council President Klein, he brought together a diverse group of stakeholders to discuss how we could better serve new Americans in Columbus. The conversation sparked excitement amongst the involved parties and led to the city commissioning a report on the human service landscape for new Americans in Central Ohio. And so often the city, or not just city, folks do reports. They ask for reports and then they put them on shelves, never to be heard from again. This is too important of a conversation because, again, it goes to who we are and who we want to be. We talk often about Columbus as a growing community, a community that will add 1 million people over the next 20 years. Well, a lot of that growth will come from the diverse faces in this room. It will look like this room. And if we truly want to be great, if we truly want to grow in the ways that will really add to the vibrancy, that will attract other people to this region, we have to do it together. We have a saying at City Council that if it's not for all, then it's not for us, then it's not for Columbus. Well, this report, this work, the leadership of our Councilmember Emmanuel Remmy is about creating policies in a community that is for all. So before I turn it over to Councilmember Emmanuel Remmy, I want to bring up the leader on the administration for all of these efforts, who has been a steadfast proponent for new Americans, for immigrants in Columbus for many, many years, Director of the Department of Neighborhoods, Ms. Director Carla Williams-Scott.
Good afternoon, and thank you, Council President Hardin, and thank you, Councilmember Remmy, for bringing us all together. And Malik, thank you to you and your team at the Y for hosting us. I bring you greetings on behalf of our Mayor, Andrew J. Ginther. And I'd like to share just a couple quick things with you. You know, the mayor says that his top 3 priorities are neighborhoods, 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 neighborhoods. And that not all of the residents of the city of Columbus have shared in the prosperity in some of those neighborhoods. And so our department is trying to help resolve just that. And so we are really looking forward to finding out information in the report and working with our colleagues in Columbus City Council to see how we can best continue to improve not only our neighborhoods, but to improve the lives for all of our immigrants and refugees that are here in this community. Just a couple of things in our department. We have the New Americans program, and several members of my team are here, so if you guys would wave. So we've got, yep, thank you. And one of the things that we're working on that I would love for each of you to be involved in, our department also works very closely with our neighborhood, area commissions, and civic associations. And so one of the things that we are working on under the leadership of Abdi Sofe and Assistant Director Toya Johnson is the New Americans Leadership Academy. And so what we want to do is work with folks in our New American community and help get you more civically engaged so that you can be a part of the community and really be a part of the fabric of everything that is Columbus. So with that, I'll step back and let us hear what we have to find out in this great report. And I'd like to bring up Councilmember Emmanuel Remmy. Thank you.
Good afternoon, everyone. Thank you for coming out today. It's a wonderful, beautiful day here in the city of Columbus. I'd like to take a moment and thank my staff, Lucy and Jeff, for their help in putting this on. I'm getting to you, just one moment. We couldn't have done all this without our community engagement team and our director of that area, Aaron Gibbons and Sandra Lopez. Certainly thank the Department of Neighborhoods, as Council President Hardin had said. And then, of course, CTV and our police liaisons that are here today. It takes a group effort and a team effort, and so we're very happy to have all of you join, and thank you so much for being here. Especially thank you to the Ohio State University College of Social Work for their hard work in completing this report, and Dr. Shivari Karandikar. Before I became city council member, I had the honor of serving as Northland's president of the Northland Community Council for 6 years. Living and leading in this diverse and vibrant community has shown me that though we take great strides in welcoming our new American neighbors, there is much more work to be done to assure that they have access to all the resources that are available to them. It is up to us, it is up to City Council and our community partners to provide this help. This study will provide local residents with a better understanding of the quality of life that our new American neighbors face in the city of Columbus. For those of us that have been around for a while, I will share with you my age a little bit, but graduating in 1990, there was not a lot of diversity in Columbus. It kind of lived up to the former reputation, something that our former mayor really hates, but it was kind of a cow town. It was a sleepy town, one that you had to clarify when you said you were from Columbus, whether it was Columbus, Georgia, Columbus, Indiana. No one quite knew where you were from. But I say that it's because of all of you in this room, all of the new Americans that have come from every continent around the world to make Columbus their home, that has provided this city with the opportunities that we see ahead of us, the vibrancy that we are experiencing, and it's the cultural enrichment that you've all brought into this city that is making it such a special place. And when we figure out how to celebrate this opportunity that we have, this city is going to be one of the tops in the nation, as I think it already is. City Council is committed to taking these results of this study and turning them into action. I look forward to continuing the discussion, the results of this discussion, bringing many of you back to the table that were working previously with former President Zach Klein, and to work to make Columbus one of an even more vibrant community than we see today. We are grateful for the Ohio State University work on this study. Collaboration and communication will go a long way in this city, and I look forward to working with each and every one of you. So before we move forward to introducing Dr. Karandikar, I am supposed to let everyone take a break, a 5-minute break, grab some food, so we can listen to this wonderful presentation about these results, and I look forward to hearing more. Thank you so much.
So my name is Sharvari Karandikar. I am an associate professor at the College of Social Work, Ohio State University, and it is my privilege to be here today and present before you the findings of the New Americans Project, which we call the NAP project, the NAP project, which we have thoroughly enjoyed working on, and I see so many familiar faces here that I feel really at home doing this. I'm a part of a 4-member team, which is, unfortunately, none of my other teammates could come here and be here. So they're all traveling. If they were in Columbus, they would have been here. And very excited to present the findings of this project. So now you have to talk to me and deal with me for this next 45 minutes. No, 15 minutes, sorry. Okay. All right, so let's look at the agenda. I'll be talking about the New Americans Project, what the project was. I'll be talking about the study design, how we did analysis. I know everyone is waiting to hear about the findings, like what did you guys find? So findings of this report, implications, and then I'll take questions. All right. So the purpose of this study was to assess formal, informal, and volunteer services currently available to new Americans in Central Ohio, identify gaps in service provision and utilization, and identify differences in service access and utilization across subpopulations of new Americans. So when the city council approached the dean of our college that, it would be good to do a research on understanding the human service landscape in Central Ohio, the dean approached the 4 of us, having experience at several points of immigrating to the United States, either as students or for work and so on, and having research expertise of doing projects, okay? But definitely, we did not have the expertise like you have of working with this population day in and day out. So the first thing that we thought of doing was that talking to people from human service organizations, people from the small ethnic community-based organizations, community leaders, members from the community, and asking them, what is it that you would like us to find out? What are the questions that you want us to ask? So even before we started designing this project, we established something that we called the steering committee, which involved inviting people from the community, and several of these individuals are in this room today, so I really do feel at home. So, inviting you and talking to you, asking you, tell me about what questions should go in this survey, because we might not always be right sitting in our offices back at Ohio State, right? So that steering committee meeting really helped. We went there with a paper and a pencil, literally wrote down things that they wanted us to ask, and those were the questions that went in the surveys that were sent out, as well as the interview guides and the focus group discussions. So this approach is called as the community-based participatory research approach. And I can talk about methodology all day long, but that is not why I'm here, so I'm going to make it really quick. We also use something called as the mixed methods research approach, which was using surveys that were quantitative, as well as interviews and focus group discussions, which were qualitative. So you use both these techniques to collect data, and then you compare the results of them and interpret and analyze them. So this was the overarching sort of the study design that we used. At any point, if you have questions that cannot wait, please raise your hands and I can stop and answer them, and that's okay. So then we ended up with about 94 surveys that were completed, 23 in-depth interviews that were done. We did 6 focus group discussions that had representations from 19 nationalities in Central Ohio, as well and a total of 48 respondents. So let me tell you a little bit more about how we ended up with these numbers, okay? What is the first thing that you would do when you're asked to identify human service organizations in Central Ohio? You try to find out directories. You look at, where do we get a list of all of these organizations? So we looked at directories, and we looked at the Ohio State University College of Social Work field database, which had about 800 plus organizations that are listed along with their contacts and email addresses and so on. So we reached out. We sent them surveys to everyone. After several tries, I think the surveys were ultimately sent to about 500 plus organizations across Central Ohio, and the response that we got was from 94. And if some of you got 4 emails, 10 emails, bothering you to do these surveys again and again, I am sorry about that, but we had to do it because we wanted you to participate. This was important. This was important not just to us, to the city, but also to our steering committee, who had told us that this information we need to find out. Okay, so at the end of these surveys was a little link that said that if you're interested in talking to us in person, reach out to us. And that's how we ended up with our in-depth interviews. We went to offices and met at coffee shops and interviewed people from human service organizations, asking them questions about what they thought were the needs of the population, as well as gaps in services. For the focus group discussions, the approach that we took was slightly different. We did not want to only include the formal service providers. We wanted to also talk to informal service providers, community members, people who are, in part of cultural organizations, small ethnic community organizations that don't get represented very often. So we reached out to these individuals, and the focus groups were done with these individuals. Okay. Any questions? Not so far. Okay. So our sample has been represented in this map. As you can see, Central Ohio, the individuals who we interviewed are serving new Americans from all of these countries. There are 33 different nationalities that human service organizations in Central Ohio are serving. I'm sure there are more, okay? And I'm sure there are more human service organizations out there that we did not include in our survey for various reasons, but this is what our sample is. So from here on now, whatever I say is based on what data we collected. And there is obviously, like other research studies, any study has limitations, and we can talk about them later on if you want, but so this is being reported from the research that we did. To talk a little bit about the findings now, when we ask the questions to human service organizations about, tell me about what you think are the needs of the new American population, this graph represents that. Language needs, we all are aware of. Everyone talked about, majority of the people talked about that. Employment, workforce, housing, transportation, A lot of people talked about education, issues with education, youth. Those were some of the needs that were identified by human service organizations. The next, so now I'll list out the key findings that are part of this project that I am sure everybody's waiting for. 68% of the organizations who we surveyed served or worked with new Americans in Central Ohio. Okay, so which means that there was a majority that said, yes, we do see clients from time to time who are from the communities that you're talking about. However, majority of these organizations said that the new Americans still have limited access to services, specifically mental health and legal services. They said that there are gaps in these services due to geographic locations where individuals are located and where the services are located, as well as in specific populations. So, for example, the population is located in a certain area, has needs that are mental health needs, but the organizations that are having services are far, and so they have to commute. They cannot commute, and so there is a gap. So there were geographic problems, there were transportation problems because of which people could not access these services. These were some obvious gaps that came up. Now, I want to also say that I'm giving a very broad, overarching sort of findings. If you see the report, which I'll show you where exactly it is, you will see the exact numbers of all of these things, along with quotes from people and so on. We have protected identities of every individual who we interviewed or talked to in this project. Nobody's names and any other details have been revealed, so it's all anonymous, but it's all there. Organizations talked about having capacity challenges to provide culturally responsive services. With this, I mean that they said that, yes, we see that these problems exist. We see that they are there. But, when it comes to our capacity in the organization, we just don't have the people who can, who will be able to respond to this. So we have issues with capacity for dealing with culturally responsive services. The one thing that came up all the time was language translation. You are translating using all kinds of services, everybody can do it. But can people do cultural interpretations? Those are very different from language interpretations. And small and big human service organizations, ethnic organizations talked about challenges in cultural interpretation. They said it's very different. And so we really have to spend more time. We don't have the capacity, again, the same thing, the capacity to do this. Community-based ethnic organizations were doing great amount of work. They were bridging the gap between the human service organizations and the community, but they felt that they were disconnected with the mainstream service providers because of lack of resources. Lack of resources as well as capacity. So they felt like they were still feeling that disconnect. Collaborations were existing between organizations. We talked with agencies that said, yes, we do collaborate with each other. I know what they do. They know what we do. We sometimes work together, but it's not always easy. It's sometimes very challenging. Service coordination is sometimes really challenging. So we see that the problems are similar. We can coordinate our services and work together, but it's not always very easy. There was incentive given to competition instead of collaboration. So funds were given out, and many agencies would try to apply for the same pot of money, and they were competing with each other, but there were no incentives given to collaborate. And this was one of the findings that came out, and we could talk more about that. There were several emerging issues that came up. Organizations talked about opioid and related substances, aging and late life migration, human trafficking, violence against women, mental health. These were problems that were, they were seeing more and more. And it's not like all of these are new problems, but they were problems that they were faced with that they were trying to build capacity around, okay? And that was where they thought they could use some more help, some more resources. So what does this all mean? What do you take away from this? For us, it was really important to highlight these points. We really believe that we should spend more time on cultural interpretation. We should spend more time understanding the value of that language cannot be just interpreted word to word, and there is more to it. Then, dialects are different, contexts are different, expertise matter in this situation, and so that's important to us. We also highlighted the need for investment in grassroots leadership in new American youth. We went to so many focus groups where there were young people with aspirations and dreams and what they wanted for themselves, how they wanted to represent their community. Let's talk about that. Let's talk about representation in education, in in positions where these youth can have the capacity, build leadership to do that. Workforce development, this came up all the time. People had skills back in their homes that they were not able to use when they came here, engineering, all kinds of degrees that they were not able to apply. These came up, and let's talk about what can be done about this. And lastly, we want to emphasize again the ecosystem of collaboration. Let's talk about collective impact. Let's talk about how agencies can collaborate with one another, how we can incentivize collaboration. There are several research steps that I can. Oh, I'm sorry, did I? Okay, so we believe that it's important to desegregate data. We are aware that we looked at new Americans. I'm talking about them like they are all the same. They're not. They're not the same. We understand that. There is differences among populations of new Americans, and we realize that it's important to do this. Secondly, I think it's really important to look at community-engaged research studies. As a researcher, I was going into talking with people, and they were like, here comes another researcher. She'll ask us questions, and she'll go away, never come back. This happens all the time, and we don't want to do that. We are done with that. So how can we engage the community in research? Is it important to them? Is it really of value? Are we going to bring it back? Are we going to talk about it after we are done to tell them what we found? Those kind of things. So let's do a community-engaged research. Let's develop culturally appropriate tools, okay? So we have a survey in English. We translate it in 4 languages. That doesn't work like that all the time. Is that even a culturally relevant tool and a measure to measure a certain research aspect? And then, of course, there is research that is, I believe, needed in the emerging issues among new Americans. We have problems that we are seeing now in specific communities that we had not seen before, and we just don't know what's going on. So let's talk about them. Let's try to research them and identify what the issues are. In conclusion, there is a strong consensus that Columbus is indeed a welcoming city, a place where new Americans rebuild their lives, thrive, and contribute to the growing socioeconomic diversity. I am really proud of being part of Columbus myself. I've lived here for 10 years, and it's a great place. This is the website that I was talking about. On the College of Social Work, Ohio State University. If you look us up, you will find the whole research report there. It's really long, so I didn't want to print copies and bring, but you will find us there. And this is our research team. And as I said, Dr. Maleku, Dr. Kogoto, Dr. Mengo could not be here, but we do have Caroline here, who was one of our students and who's now with the Ohio Latino Affairs Commission. So thank you very much for coming, for moral support, and Steve. And I'll be taking questions. So thank you.
First, thank you for presenting these results. I wholeheartedly agree with you in that Columbus is a welcoming city, and I would like to know how you quantified that through the study. If someone were to ask you in research language, what did you find exactly that makes you draw that conclusion?
Right, yeah, so definitely we did ask the question that do you think Columbus is a welcoming city? And then we do have percentages that majority of the people from human service organizations said that yes, they do feel welcome in Columbus. Now, one thing that you need to remember is that we interviewed not the community members so much, but the human service organizations. So this is a perspective that comes from people in social services that, they perceive that Columbus is a welcoming city. So yes, there is a majority consensus on that, use of that word even, welcoming. So, yes.
Maybe I want to thank you for this presentation, and I was part of the steering committee. I'm very glad that we were able to contribute. But one thing that maybe I want to highlight is the cultural interpretation. What happened was we are generally taken as Nepali, and then the interpretation agencies that work nationwide or even locally expect that people understand is standard Nepali. But we migrated from Nepal maybe 200 years ago, and the language has changed a lot. Mm-hmm. And English became, the medical terms in English became a general word in Nepal. And when people went to hospital, and when someone is translating in standard Nepali, people weren't understanding. Mm-hmm. To give you an example, what happened with Ohio State University, one of our community members, he still interprets at Ohio State University. He wasn't at the time available to do the interpretation, and somebody was interpreting that old lady who she had to go for a surgery, and the person on the other end was talking very standard Nepali, which is a good thing. But in standard Nepali, if you have a surgery, then the word is Salya Kriya. So some of you who are from India or Indian subcontinent understand that word, Salya Kriya. But the only word Kriya means funeral rites. So she was going to go to surgery, and she only heard Kriya. And she was like, what are you talking about, right? I'm just ready to go for a surgery. And that really sucked, and she could not understand what the person was talking through the video conference. And then they had to bring in this gentleman who was maybe at some, different location. And then he translated in Nepali, Bhutanese Nepali way. So that's just to give you an example how a cultural translation would be even when we speak the same language. And thank you for bringing that. I think that was very important too. We have been trying to put this to the interpretation agencies and hospitals for the last 2-3 years, saying, hey, there is some gap in interpretation. Please look into this. This community speaks slightly different dialect, different Nepali. And then thank you.
Yes, absolutely, yes. And if Dr. Maleko was here, she would tell you that she being from Nepal, working with the Bhutanese youth that she works with here, also the dialect changes. The context is different. These people have different experiences. They are so individually specialized in a way that even people from Nepal don't have the same experience as the Bhutanese Nepali have. So thank you, Sudarshan, yes.
I'm from Somalia, Somali language. And that person might not be even able to speak Somali. He speaks English. In here, came when he was 3 years old, and he's learning the Somali language. Or this person that came from the neighboring country of Somalia, which they speak a limited English, so they cannot translate the language. As an organization, the Somali community, and Nepalese, we don't have an access to the interpretation services to provide the quality, and this is a lifeline. Because when you come to the hospital and you have a surgery or you have some critical issues, and then you don't have an interpreter, and some other organizations have a contract, that's really something that's hurting the community. It's not unique for one organization, and it's not isolated. It's a common problem that the community faces.
Yes, every single interview and every single survey. Every single time they pointed this out, that language translation is not equal to cultural translation. Cultural interpretation is different. So this is the biggest takeaway one of the biggest takeaways from this. Yes, sir.
How did you find differentiating the two? Because a lot of the immigrants that we have, whether they're from Guinea, from Francophone countries, or from other places that come here with degrees, have a problem not just translating their degrees, but also learning enough English to be able to have their, to be able to really maximize the degrees that they've spent years learning and getting from different countries. So how did you differentiate those two?
Between groups? Between countries, yeah. So so as I said before, we did about 6 focus group discussions. There were 2 Latino groups, 2 African groups, 1 Bhutanese group, 1 Somali group. So we had several different, 1 Asian group, 2 Asian groups, I think. So anyway, so we did see differences in people's experiences. And if you see the report, we have not named people or communities. We have said that, yes, from African focus group discussion, or so and so. We have really tried to keep people anonymous, but yes, there was, for example, we did an Iraqi group, and people talked about being engineers and coming here and not being able to work at all. So, so yes, there was, of course, a difference between groups and communities. Again, we duly need to look at this data, desegregate it among groups. I know that, even makes me uncomfortable to club everybody in the same group and say, yeah, this is the problem of all new Americans. I'm one of them, and I don't like it either. So, I understand that. So if you read the report, we have tried to segregate some of that, but there is more work that we need to do to hone into specific communities and talk about the problems. So thank you for bringing it up. Thank you.
Yeah. Thank you very much for bringing the emerging issue of violence against women. Thing is, it's not a new issue. Gender-based violence, rape, torture, sexual assault, female genital mutilation, all of those issues existed for a long, long time. And we see all of that when we serve people through some of the programs that we have. What I wonder is, what have you heard in your focus groups from communities? Because what we find is that it's a very difficult conversation to have with communities. And it's much easier to talk about issues of workforce and youth than about issues of violence against women in ethnic communities themselves.
That's a great point, and thank you for bringing it up, because that's one of my research areas as well. So yes, it was not easy to broach that topic, and we did not go with the agenda to broach certain amount of topics at a focus group discussion. So it was not like, yeah, we're going to talk about this and this and this, but it did come up, and it came up in one specific focus group discussion was the first thing that's how it started, and that's how it was striking to me that this is such a big issue in this community. And again, it's not something that people haven't faced. They have faced this for their whole entire life. Back home, here, it's the reality, right? So we did see this in one particular focus group. Without naming names, it was there. It is very prevalent, but I'm sure it's there in all communities. And you're right, it's not something that comes up. It's very difficult to broach that topic. So, yes.
I'm originally from Africa, and typically drugs are kind of taboo.
Yes.
So I would be curious to find out what they're trying.
Yes. Again, yes, it's a very good question. Then I have more slides. There were like 38 slides, but thankfully I did not present all of them. So we do have specific details on communities that are unfortunately having to tackle this substance abuse and opioid problem. It is very specific to communities, among the new American population, and they're seeing suicides, they're seeing all kinds of, depression, addiction, violence that is connected with substance abuse, those related issues. Again, this is not to say that everybody has this problem, but it is one of the emerging issues. And the problem that the way we approached it was that asking the human service organizations, how do you see this, and then what do you do? And they're like, yes, we do see this, and we are not kind of sure about what we should do because this is so new. This is something that has happened over the past couple years, at least. So this is an emerging issue, definitely. And I can go over that slide with you in person to show you exact statistics on communities and so on. So thank you. Yes. Sure, yeah, so yes, this did come up in the focus group discussions with the community. There were members who were, youth members from the community who were there at some of these focus groups, and they talked about how about we take leadership positions? How can we, get training specifically to for example, education was such a big issue among certain populations, that bullying that is happening in school, or, there's just the violence that, little kids have to face, emotional violence on a day-to-day basis, being bullied. How can we take positions of power in the school boards? And this came up, but also, wanting to get trained, wanting to take those positions and lead from the front. I think that was really, it did stand out. There are quotes that we have in the report that talk about this. They made some really wonderful quotes that we have used throughout the report that were just very original and empowering. So again, I would encourage you to read the report to see the specifics of how they talked about wanting what they wanted in terms of what the youth wanted, but they definitely talked about wanting to be in leadership positions around the city. Anybody else? Yes, sir.
I was interested in the comments about how the system is set up to encourage competition versus collaboration. Yes. And I'm just curious if you learned anything about why that matters, like why a greater, deeper collaborative environment might be beneficial to new Americans.
Okay, so yes, the system is set up for competition because the grants are few. Okay, so when the grants go out, there are several agencies that do sort of similar work, would try to still say, okay, we do it, and then try to apply for the grants, okay? It's a common, this is very common in the human service world. Why collaboration is important is because if you try to set up a grant in such a way that it says, we want a grant that fosters collaboration between organizations to achieve this common goal, then you're forcing these organizations to work together, to collaborate so that they're not fighting about the money, but they were both going to get, part of the funds. And that was one of the issues, because organizations are trying to also survive. They're trying to maintain themselves in this political environment. We know how difficult it has been for the past 1.5 years for everybody to survive. More questions? Sorry.
I think there are collaborations happening as we speak right now through Jewish Family Services, Us Together, and ETSS and CRIS by improving the quality of lives of employment, at least in that sense. And the facilitator is Franklin County Job and Family Services, who brought us together because we are the experts in this room that can really move people forward. So yes, in other parts there are competition, but I feel like the employment part, I feel like the collaboration is really strong and we're moving people forward.
Okay.
So, so I just wanted to add that little.
Yes. Yeah, and thank you for saying that, Tariq, because we did say that, yes, there are collaborations. For example, referrals. You cannot survive without referrals, right? If there is something that you can do, you always refer them to another organization. Or you always work together, pool in your support to figure out a certain legal matter, for example. So yes, we do have cases of collaboration, but then also, they did talk about, yes, it could have been, with funding especially, it could have been better if there is more collaboration in that aspect as well. Yes.
One thing that we talk about partnership, and I really agree, we as a BNCC or BCC or as a small organization, we partner with the bigger organization. Definitely that is true. But I think one thing that we have to realize that the importance of smaller organizations, smaller ethnic-based organizations is very important when we talk about integration that Tara is bringing. And when we seek out for grants, what happens is usually the bigger organizations who have establishment, who have a name, who have someone who can write professionally, do get grants and then they survive eventually. Nothing against the organization, we are friends, we are partners. But I think we have to bring reality into this topic. And me as a one person trying to run an organization, I have to grant write, I have to do my auditing, I have to be my accountant and everything else, and I'm not an expert. And usually what happens is that grant that I propose would go into the corner because it's not a professional looking, right? So I cannot talk this issue at a federal level, but at local level, I think we need to see and we have to give priority to local ethnic-based communities that they may not have expertise in place. They may not hire someone who can write awesome grants, but what is the need in the community? Are they serving or not? What population they are serving? Are they key organization in providing that integration or services to the community? I think those factors need to be taken into consideration while awarding the grants. And I don't know how the grants are awarded, but we got so many grants denied, and I called to them, and they said, well, we have an independent jury that gives a point on every paragraph or every question, and it's based on that. So someone in DC may not know that one, but in Columbus, I think we have to bring this approach. And I'm not talking just for Bhutanese community. Any other ethnic, smaller organization should have a slightly different criteria to look into the importance, why they are applying, and how they should be judged.
Absolutely, great point. You cannot say anything more to this. This is absolutely true. Very important. Yes.
Either overcrowded or lack of, that neighborhood, or sometimes we both last year. I worked with Somali Community Association of Ohio, and last year there was a neighborhood treated badly for tenants, and then we took the money to the escrow court for 38 families for 6 months, and finally they agreed to give back the tenants some half of the money, and that's not. It happens every day. We worked with the Legal Aid Society last year, 417 families who've been affected by eviction. And that's continued. We have a weather right now, we see that 90 degree, 100 degree. And there are families, today, 8 families do not have air conditioners more than 2 months. We reached out the city, we reached out the county, we reached out everybody, to be honest with you. Try to explain to them. My friend was talking about the funding source. We've been serving for Somalia for the last 20 years, 18 years. And we have a social security for 32,000 people since 2001. And whenever we put together, something, we never had a problem when it comes to financial responsibility. We don't have a problem with we exceed always the performance. And yet, even though we represent for some other communities, some other people speak for us. When it comes to the county, some people other speaks for us. When we go to the city, some other people speak for us. And then, yet, when you watch a TV, they say Somali's the largest immigrants. When you read the newspaper, they say Somali's the largest. And then you don't see that.
Yeah.
I've been 40 for 20 years. I don't, you know, I'm not considering myself Native American. I'm American. Sometimes Native American is like, well, you know, however, I don't want to raise that issue. But the reality is, the communities need equal access to the city, to the county, and everywhere. Thank you.
That's a good point. Thank you so much. Do you want to respond?
Yeah.
Okay.
All right. Thank you very much. Appreciate all the comments and questions. Thank you to Dr. Karandikar, the Ohio State College of Social Work, and all of the human service providers that were involved in this study. It is because of your hard work we can continue to grow this city in the direction that we need. I'd like to also thank my comms team, which I missed a little bit earlier, Lee and Cheryl, for all of their hard work today. As you can hear, we have a lot of things to tackle and accomplish. There's a lot of discussion ahead of us, and I really look forward to reading through the report and working with each one of you to discuss further the opportunities that exist to make Columbus an even greater place for our new American population. We want everyone to have equal access to the opportunities that people that have lived here all their lives may have. And so we need to figure out ways, working collaboratively with you in the community, of bridging those gaps. And so I'll be talking with many of you as we move forward. I will be convening small groups to further the discussion on a variety of issues. And we'll be announcing many more next steps to use this data to make Columbus one of the most welcoming cities for our new American population. And I really am honored to lead this charge. We look forward to using this data to work with all of our human services groups and improve the lives of all the new American residents in Columbus. So thank you all for coming out today. It's great to meet many of you. Thank you.